As consumers demand more and more convenience, faster services, and more options, healthcare has gone digital. And this is largely a good thing. We have rural areas getting expanded access to care, able to reach otherwise people who may be isolated. However, there are risks that we need to mitigate too, those being falsified medicines. But what is a falsified medicine? You may know it as a fake drug, anything that misrepresents its identity, composition, or source. We don't know what's in it. We don't know how it was made, if it was in sterile conditions, if it has any active pharmaceutical ingredient at all. There's an important differentiation between a falsified medicine and a substandard one, and that is criminal intent. Organized criminal groups enrich themselves through the sale of falsified medicines, whereas a substandard medicine has a legitimate manufacturer. It could be that there was poor manufacturing practice, or somewhere along the supply chain, or at the end point, the medicine was exposed to either heat or humidity that degraded the quality of the product, making it substandard. And then an unregistered or unlicensed product is something that is just not authorized for that country. With falsified medicines, however, sometimes you may hear of this interchangeably as a counterfeit medicine. However, the WHO ditched this term. Previously, it was known as spurious, substandard, falsely labeled, falsified, counterfeit medicines. A mouthful, very confusing. Counterfeit is viewed as more of a trademark infringement and not a public health issue, and that is why in WHO language, we use falsified medicines. And this has a huge cost to health, a huge cost to our economy as well. We know that this is the most lucrative illicit trade that there is. It beats out illicit drugs, human trafficking, all of them. You can make $200 billion in terms of the whole market worth. And that costs us in the long run because we have people who may have a disease that then progresses into disability or, in the worst case scenario, even death. 1 in 10 medicines in low and middle income countries are either substandard or falsified, which means 1 in 10 people could end up being harmed as a result. Now, in some countries, that statistic is much, much higher. And in high-income countries, it's usually more due to illegal online pharmacies, people going to social media to purchase products. What we see is that this can then, as a result, lead to a degradation of trust, not only in healthcare systems, healthcare professionals, but in the medicines themselves. And in this environment now, trust is already very shaky. Here are some examples of falsified medicines. For the first time ever, WHO had alerted, it's a global alert to say they identified falsified Ozempic. This is known as some skinny jab. Semaglutide is the active ingredient in the US, the UK, and Brazil. And this is in the legal supply chain. So that is what they were able to find. The true data could paint an even more worrying picture. MHRA sees 369 fake Ozempic pens, but they also have limited regular capacity. The real problem is when we start to move into online spaces. Like I said, it's very difficult for people to be able to identify what is a legitimate online pharmacy and what is illegal. So I'm Canadian, for instance. I could create a website, put on a white coat, Canadian flag, especially appeal to my American colleagues and say, cheap drugs, and we're nice, so you can trust us. And people will then be deceived. Some companies have gone so far, or should I say organized criminal groups, to even post fake reviews and customer service helplines. If I were to ask you here today, can you tell the difference between a legal online pharmacy and an illegal one? Could you do so with confidence? Well, let's play a game. If we go to the next slide, it's about coffee time break, so I thought, get you all involved. Which one do you think is fake? So, hands up if you think A, is fake Ozempic or B? So hands up for A. Hands up for B. It's about a split audience. What would you say, Susan?
I would say we don't have the right answer.
Okay, for those of you that said A, well done. This is indeed the falsified product, but they can be almost identical. So you could have both looking the same. You could only tell the difference through the barcode itself if you were to check that. So that becomes very difficult for consumers and patients alike to be able to discern the difference. And I think with this product in particular, there is the added sort of celebrity hype. We've all heard the joke that the Oscars were sponsored by Ozempic. The public perception of this drug is more as a lifestyle medication than a highly regulated product that has risks and requires clinical criteria. But it's not just these medicines that are at risk. WHO has received reports for all classes of medications, including cancer drugs, antibiotics, even cheap over-the-counter medicines. But could you imagine being a cancer patient receiving a falsified cancer drug, or your loved one, and what the cost of that would be, the consequences? Right now, we know that this is a high-profit, low-risk scenario, because if you were to sell a falsified cancer drug, you would receive less jail time than selling heroin. And so there is a big need for legislative and regulatory reform. Online pharmacies, about 42%, according to a recent study from 2024, shows that we have a high amount, almost half, that are either operating without a license or don't require a prescription, and therefore they're breaching regulations in some way. This is not safe clinical care, and it makes it even more difficult to identify which is a legal versus illegal online pharmacy when we have bad actors in that group. Approximately 20 new pharmacies that are illegal pop up every day, overwhelming regulatory capacity and creating a whack-a-mole problem where as soon as you shut down one, another fake pharmacy appears in its midst. Again, at the end of this, threatening patient safety above all. In the UK, the GPHC, which is our pharmacy regulatory body, is trying to tighten up the regulations around that, requiring further clinical screening. There's been a big boom in online pharmacies as well. From 2016 to 2021, we saw 301% growth. This trend has stabilized since. Pandemic were the good years, but we do see, in turn, brick-and-mortar pharmacies are starting to decline. 1,223 pharmacies closed in England alone, 7,000 in the United States. Some are now opting for a hybrid model, but the point being that if we are going to see continued growth in this space, we need to have the safe protocol alongside it. So that's taking me to my final message. We are here to talk about the Fight the Fakes Alliance, which is a group of stakeholders from all sorts of organizations, including GS1, that are trying to raise the awareness around this issue and implement feasible solutions. So I hope that you will join us in our mission, and thank you very much. It's a pleasure to speak to you today.